diamond-shaped area of the liver parenchyma, which provides nutrition and collects bile secretion, is known as portal acinus or liver acinus. It forms the structural and metabolic function units of the liver, centered on a pre-terminal branch of the hepatic arteriole and bounded by the territories of the other acinus. It is pre-terminal branch of hepatic arteriole and bounded by the territories of other acinus and central veins of two adjacent lobules. Other acinus and central veins of two adjacent lobules and territories of other acinus. There are about 1 lakh acini in human liver. The acinus is subdivided into three zones according to the gradients of blood supply. Gradients of blood supply: zone 1, zone 2, zone 3. Zone 1, zone 2, zone 3. Zone 1 is the inner zone around the vascular backbone and is well oxygenated. This is the vascular backbone and well oxygenated. Intermediate is moderately oxygenated, and the outer zone is close to the central vein and is least oxygenated and most susceptible to anoxic injury. Anoxic injury. In circulating in circulating disturbances, the zone 3 is suffered first, and then zone 2, and then zone 1 due to vascularity decreases from zone 1 to zone 3. What is the space of this and space of mole between the walls of the sinusoids and hepatic lamina of cells? So this is the maybe think this is central venule and this is a portal hepatic lobule. So this is the sinusoids, sinusoids. Now that the sinusoids, walls of sinusoids and hepatic lamina of cells exist potential space. So this is the sinusoid, and this is the hepatic lamina of cells. There is a potential space between them, which is known as spaces of Disa or perisinusoidal space. These spaces are filled with blood plasma, blood plasma. Then here is chylomicrons, which is of significant, remarkable, significant structure or uh, significant. You can say is what the word is unique structure, which percolate through the fenestrated walls of sinusoid. Which percolate with the through the walls of sinusoid and contain in addition to ito cells. Here remains ito cells. Species of mole are the potential spaces appear in the interlobular spaces between the this is the interlobular space. This thing is an interlobular space. So there is a potential space appear between the Gleason's capsule and the portal canal. This is the uh, Gleason's capsule, and there is a portal canal. There is a uh, space, potential space, and hepatic plates of cells. The hepatic plates of cells and portal canal এর সাথে মানে গ্লিসোস ক্যাপসুল পোর্টাল ক্যানাল এবং হেপাটিক প্লেটস অফ সেলস এর মাঝখানে হচ্ছে আমাদের থাকে হচ্ছে একটা পটেনশিয়াল স্পেস, সেটাকে বলতেছে আমরা হচ্ছে স্পেস অফ মল। লিম্ফেটিক্স অফ লিভার বিগিন ইন দ্য স্পেসেস অফ মল অ্যাজ ব্লান্ট রেডিক্যালস। তার মধ্যে কি কি সেলস আছে? হেপাটোসাইটস আছে, তারপর যেটাকে আমরা বলতে পারি প্যারেনকেমাল সেলস, তারপর হেপাটিক স্টিলেট সেলস অর নোন অ্যাজ ইটো সেলস, তারপর ম্যাক্রোফেজেস, কাফার সেলস, লার্জ গ্র্যানুলার লিম্ফোসাইটস অর পিট সেলস এবং সাইনোসয়েডাল এন্ডোথেলিয়াল সেলস। তো হেপাটোসাইট যেটা আছে এটা হচ্ছে কি বাইল প্রোডাকশন এন্ড সিক্রেশন, তারপর মেটাবলিজম অফ নিউট্রিয়েন্টস, তারপর সিনথেসিস এন্ড সিক্রেশন অফ প্লাজমা প্রোটিনস except immunoglobulin and coagulation factors. The bile salt and bilirubin, excretion of bile salt and bilirubin. Hepatic cells or ইটো cells এটা কি করে কোলাজেন ম্যাট্রিক্স সিক্রেট করে including proteoglycans and growth factor দেয় for the regeneration of the damaged liver cells, replace the defunct liver cells with collagen fibers as defunct liver cells um, with collagen fibers as found in cirrhosis and storage of fat soluble vitamin A in the lipid droplets. Macrophages, they are the phagocytic cells of liver and remove cellular debris and microbial agents from the circulating blood and belong to the defensive mononuclear phagocyte system. Large granular lymphocytes or pit cells, they are the natural killer cells which provide protection against viral and other infectious diseases. Agents, sinusoidal endothelial cells, lipoprotein uptake and binding. Phagocytic cell of the liver. It is a cilia-shaped Kupffer cells derived from the bone marrow. The phagocytic cells of liver lie within the hepatic sinusoids. Function: they remove cellular debris and microbial agents from the circulating blood and belong to the defensive mononuclear phagocyte system. Give the blood supply to the liver. Blood supply to the liver. The liver receives 20% of its blood supply through the hepatic artery and 80% through the portal vein. Out of 1500 milliliter of blood circulating through the liver per minute, about 4/5 of the blood, 12 milliliter, is derived from the portal vein, and remaining 300 milliliter of blood per minute is conveyed by the hepatic artery. So, what is the mode of blood supply? Hepatic artery and portal vein to the right and left branches, segmental vessels, interlobular vessels open into hepatic sinusoids, drain into interlobular veins, drain to from hepatic artery and portal vein, then right and left branches, তারপর segmental, তারপর interlobular, তারপর হেপাটিক সাইনোসয়েড, তারপর হচ্ছে ইন্টারলোবুলার ভেইনস, তারপর হচ্ছে সাবলোবুলার ভেইন, তারপর আবার হেপাটিক ভেইন, তারপর হচ্ছে ইনফেরিয়র ভেনা কেভা. I think I'm doing something kind of problem because I do have a very good note of these type of things. লিভার না, এটা বকুল না. I think I did a mistake. So the mode of the mode of ব্লাড সাপ্লাই কথা বলি, তাহলে হচ্ছে কি যে hepatic artery, lobar artery, segmental, hepatic, lobar, segmental, interlobular, distributing inlet, তারপর সাইনোসয়েড, সেখান থেকে সেন্ট্রাল ভেন, সেখানে সাবলোবুলার, হেপাটিক, তারপর মানে ক্যাবা। Supports of liver. Liver is stabilized and maintains position in the right upper part of the abdomen by both static and dynamic factors. The three-tier classification of the supporting structure has been proposed. The suspensory attachment at the posterior abdominal wall to the inferior vena cava, hepatic veins, coronary and triangular ligaments, primary factors. The support provided by the right kidney, right coliflex of the pancreatic complex, secondary factors, and the attachment of the anterior abdominal wall and diaphragm by falciform ligament, tertiary factor. Development of the liver, endodermal foreguard parasympathetic of hepatic part, parenchyma hepatocytes মধ্যে, তারপর হচ্ছে স্ট্রমা বা গ্লিসুস ক্যাপসুল হেমাটোপয়েটিক সেলস, কাপফার সেল হচ্ছে connective tissue cells like ito cells আস্তে আস্তে সেল টু ট্রান্সভার্সাল থেকে, and hepatic sinusoids develop just এটা develop করা হচ্ছে due to breakdown of vital line and umbilical veins by hepatic cords.